More than 150 nations, representing nearly 2/3 of the world's population, have committed to receiving COVID-19 vaccines through COVAX. Now, the initiative, set up by the World Health Organization, aims to ensure 2 billion doses of safe, effective and affordable COVID-19 vaccines by 2021. It's co-chaired by Singapore and Switzerland. And joining us now is Ambassador Nora Kronig Romero. She is Vice Director General and Ambassador for Global Health at the Swiss Federal Office of Public Health. Good evening, Ambassador. What exactly does the legally binding commitment agreement mean?
Good evening. Concretely, it means that we decided as Switzerland to buy vaccines from the COVAX facility, meaning that we will participate to the upfront risk payment, pool the resources, share the risk, and be able to buy vaccines if they do become safe and, of course, effective from the facility directly.
And Ambassador, what will be then the real impact for countries who've entered into the agreement?
The real impact is that it really is for us the possibility to share efforts at the global level, to participate to risk pooling, meaning that we do put our resources together to have a broader portfolio of vaccines and access to more candidates than what we can have access to if we would go only through bilateral agreements or other grouping agreements, if that is possible in some cases, with the possibility to together have a better acceleration of research and development of a safe and effective vaccine, and also participate to a fair distribution globally.
There will undoubtedly be great demand for the vaccine once it's available. What is the targeted percentage of the population that's expected to receive this vaccination, though?
You know, the COVAX facility is the first mechanism that has been put into place historically that gives us the possibility to globally come together and buy vaccines from one single joint facility. And to that extent, it will be, in our opinion, already a success if we are even able to reach the minimum that has been set of a vaccination of 3% of the population. But I think that the targeted goal really is to be able to cover around 20% of the world population and to cover it with vaccines through the facility, which is, of course, a very big challenge that we will work for. But to be quite honest, I do think that we are all engaged to reach that goal, but even a smaller percentage would be, in our opinion, a real success, because we would have come together, put up a mechanism that we can also use in the future and also use in potential future pandemics.
And there are many countries involved in this, but there are two that are missing, the US and China. How significant are the efforts ongoing without them?
You know, I think, as I said, the facility is the first time we've been able to put together such a global mechanism. It is a flexible mechanism that gives every country the possibility to go to access the vaccine through that possibility, and gives us access to the broadest portfolio that exists of vaccines worldwide. Since it was constructed around this idea of the flexibility, but also around the idea of really working very closely and directly with the private sector to that endeavor, that I think it's normal that we don't have 195 countries at the first step that would actually come together. I think that what is important is that the mechanisms work fine with a governance that is clearly established, with the possibility to make sure that there is an as equal as possible distribution, and of course a coming together of those efforts. I think we will be able, based on that first success, to then build up and of course the access to the facility is open to all the countries in the world. And I do think that the strong group that we've been leading together with the friends from Singapore has really given us the possibility to play a very active role and also come together and do that, and then be as open as possible for everybody to join in the future, should that be in the interest of other countries as well.
And in light of that consideration, Ambassador, what about those countries who are entering into direct arrangements with drug makers themselves? Does this agreement preclude those countries?
No, not at all. As I said, the facility was built up in a very flexible way. I think that we have to be mindful of the fact that most countries, or all countries, in fact, do have own regulations to make sure that they have safe and effective vaccines for their populations. In some countries with proper regulatory authorities that give market authorizations. So in building up the design of the facility, we had to be very mindful of the different dimensions that are important depending on the country context. So we've always engaged very much to be as flexible as possible. Also mindful of the fact that we didn't have the facility when the COVID-19 pandemic started. So we did have to build it up. And I think that many countries went a bilateral way, also because it is a way to give confidence to the private sector, to fuel research and development, and to make sure that the production capacities are built up as soon as possible through that channel of procurement. So everybody is invited and welcome to join, and there are no constraints of those sorts that will build up into the mechanism in order to avoid any difficulties of access for certain countries.
Ambassador, thank you very much for speaking with us. Ambassador Nora Kronig, Vice Director General and Ambassador for Global Health at the Swiss Federal Office of Public Health.